Yesterday, the Regional Health Officer of Region 6 revealed that active COVID-19 cases are rising in Region 6. Jalissa Hines reports.
During a press briefing held yesterday at the Regional Democratic Council's boardroom, Regional Health Officer Dr. Vishalya Sharma delivered an update on COVID-19 in Region 6.
This year we would have entered the holiday with over 100 actives. As a result of what's happening, we have now in our region in the past 2 to 3 days seen an incline of more than 200 cases happening in a very short time. We take into account this number is changing quite rapidly as we're constantly testing persons within our region. Today we have in Region 6 4,350 cases of COVID-19, of which an alarming amount, 559, is currently active within our region. The distribution, this is our fourth incline, as I would have stated earlier. Also alarming to note is that December has been our deadliest month with 19 deaths out of 112. Also, Region 6 presently accounts for 10% of the national deaths.
Dr. Sharma went on to disclose the distribution of the active cases.
Our present distribution of 559, Kanji has been always one of the hotspots, especially Cumberland area. We now have 112 cases there. Quarantine, which is one of the areas that we would not have seen activity earlier in the year, but we would have noticed in the latter half it's started to incline gradually. We now have 200 actives. No community is off the radar as we speak. Each and every community is affected. New Amsterdam, we now have 191 actives. Oriala is stated 12, Siparuta 1, and Skeldon during the last 3 months of last year was inclining, but now they're actually down to 43.
She further stated,
This year so far we would have had 5 deaths. And in our 2 units across the region, we would have seen in 2021 a total of 191 patients receiving care for more than 5 days across the region. That's with the 5-bed capacity we have at New Amsterdam and the 18-bed at Skeldon. Just to note that the health sector is also affected as a percentage of our staff is also infected.
with the increase in COVID-19 cases in the region, Dr. Sharma revealed these details as it relates to the booster immunization.
Good note in Region 6, what we have noted for the past week, an increased uptake of the booster doses. So that is really good to know, and we're encouraging the population to please visit one of the 11 health centers and have a booster shot there. We would have started with 5 sites, and looking at the increase in the uptake, we would have extended to 11 sites, including Maiduguri and Oriala.
Regarding test sites, she said,
We haven't made any additions to our testing sites, but it's one of the areas we're looking at to do additional training so our health centers can start take off some of the load from the hospital in terms of testing, swabbing.
Regional Chairman Region 6, Mr. David Armagon, encouraged the residents to get vaccinated.
I hope that people are taking stock of what is happening. Many people, in fact, 6 persons died quite recently within the Berbice area, and that's too much for us. So I'm encouraging people to take the vaccine, and in the case of those persons who would have already had 2 doses, to ensure that you also take the booster.
Mr. Armagon highlighted these details about the Omicron variant.
As you know, the Minister of Health has also announced that we have taken samples from persons who are now sick with COVID, and we are sending them to Trinidad for them to determine whether the Omicron virus is here with us in Guyana. We suspect that because of the way the spread is happening, the way the number of persons that are getting infected. We suspect that Omicron might be present here in Guyana. We had anticipated that after the holiday season, we would have had a spike, but not to the extent that we are experiencing at the moment.
The chairman then highlighted the infectious disease unit, which will soon be open at the New Amsterdam Hospital.
Very shortly, the health system is going to be overwhelmed with the number of cases that we are having. If you look at the New Amsterdam Hospital, for instance, they are almost filled to capacity. And that is why we are hurrying to have the infectious disease unit. There's a new unit that we are putting up at the New Amsterdam Hospital. We have pushed the contractor and he's worked very hard to get that unit going. I think from next week, I understand that unit is going to be open.
There is an expected increase in the current cases since over 100 persons are awaiting COVID-19 test results in Region 6. Reporting for Channel 8 News, I am Jalissa Hines.